The teaching of gross anatomy has long relied on the dissection of humans and other animals. Of course, examining the anatomy of non-human animals is as old as our use of their skins, bones, organs, and meat. But I'm sure that a certain amount of dissection of fellow human beings, whether through funeral customs, primitive attempts at surgery, or during warfare and other conflicts, is equally as ancient. However, the practice of exploring the human body for scientific purposes, as a way of knowing the internal anatomical detail of the human form, has been documented back to at least the 3rd century BCE in Greece. The original cadavers of Greco-Roman times were bodies of executed criminals who were examined as part of an effort to establish Alexandria as a seat of Greek medicine. But following the early dissections of Herophilos and others, dissection was essentially taboo for the next 2,000 years, which led to grave robbing by so-called resurrection men or the use of unclaimed bodies from morgues. As we begin our first lesson into full gross anatomy exploration, let me reintroduce you to the Anatomage software system, a technology that some refer to as a virtual autopsy table. This software was initially based upon data gathered by the Visible Human Project through the University of Colorado School of Medicine, in which a male cadaver was first frozen in order to stabilize the tissues, and then cross-sectioned into planes that were mere millimeters in thickness. The slices were then photographed and all the images digitized. The resulting data set is maintained by the National Library of Medicine. This original Project Cadaver has a story that is both intriguing and troubling, hearkening back to those ancient times. Mr. Joseph Paul Jernigan, who you see here, was convicted of murder in Texas and sentenced to death by lethal injection. The prison chaplain convinced Jernigan to donate his body for science, and he was executed in 1993 at the age of 39. Since that time, other cadavers have been added to the digital data bank of the Visible Human Project. The Anatomage company has been a leader in medical imaging since 2004. Their use of computer software to present images from the Visible Human Project is simply amazing. In addition to digitized cadaver images, Anatomage also includes medical images from patients to present a variety of clinical issues, as well as medical devices and treatments. In all of my undergraduate and graduate anatomy courses, I use a combination of teaching methods. We have Anatomage tables for the high-tech approach, as well as cadaver dissections for the classical approach to studying anatomy. Now, let's move on with our lesson. Lessons 7 through 11 were about the axial portion of the body. So let's take a look now at the axial skeleton. We've got our cadaver here. Let's take it down to the bones. All right, let's start with the skull. So as we know, there's 8 bones of the brain case. Here we see the frontal bone, and laterally we see the parietal bone, we see the temporal bone, and between all of those we see the sphenoid bone, which we can see from a lot of different directions of the skull because it's kind of a buttress of the skull. It's a midline structure. If we go posteriorly, we see the occipital bone. Then we see the opposite side parietal bone, the temporal bone on this side, and back to that sphenoid bone. But that's only 7 bones. What about the ethmoid bone, which is part of the brain case, but difficult to see from this side? So to see that final bone of the cranial region, we need to go inside the skull. Here is the ethmoid bone. Most of its anatomy is more associated with the face, but because of the small portion of it that extends into the brain case, it is considered one of the 8 cranial bones. Remember the sutures of the skull? Those are the joints between individual skull bones. So if we tilt down, we can see the coronal suture between the frontal bone and the two parietal bones. If we continue to tilt, we can see the sagittal suture on the midline between the two parietal bones. If we want a bird's eye view of that, we can go to the top of the skull and we can see the sagittal suture between the two parietal bones, the coronal suture between the parietal bones and the frontal bone. And if we tilt posteriorly, we can see the lambdoid suture or lambdoidal suture between the occipital bone and the two paired parietal bones. And remember pterion? It's not a precise spot, it's more of a four corners region like you might see on a map, where the temporal bone, the parietal bone, the frontal bone, and the sphenoid bone all converge. So it's a region of the thinnest area of bone in the skull. So how about the 14 bones of the facial region? If you remember, 2 are unpaired and the rest are all paired bones. Let's start with the obvious mandible, right? The lower jaw, a singular bone that has an alveolar ridge to house the lower teeth. And here's the maxilla. Anatomage presents them both at the same time, but there is a left and a right maxillary bone, or maxillae as they're called. And those house the upper teeth in their alveolar ridge. We can see the nasal bones. There's right and left nasal bones. As well as in the corner of the eye, we can see the lacrimal bone. Now, each lacrimal bone is very small, the smallest bones of the face, but it's covered over here slightly by the lacrimal sac and duct in this view. Then we can see the zygomatic bones on either side, right and left. And if we go internally into the nasal cavity, we see the right nasal concha, the left is on the opposite side, and between them sits the vomer bone. The vomer is the other unpaired bone of the facial region. Now, a lot of this anatomy of the upper nose region is made up by the ethmoid bone. The upper region of the nasal cavity has a perpendicular plate made of the ethmoid bone, as well as some lateral masses that house the sinuses. And we can see that in the eye orbit, the ethmoid bone can be seen as well, but it is a bone of the brain case, not of the facial region. And here we see the palatine bone. The palatine bones are hard to find in a full skull, but they make up a small portion of the lateral nasal wall most posteriorly and a small portion of the posterior palate. The more anterior part of the palate is made up by the maxillary bones. And here we can easily see how the maxilla makes up most of the lateral nasal wall and also how the nasal concha hangs from that maxillary bone. There is a superior and middle nasal concha that are part of the ethmoid bone. You might be wondering what this projection is behind the palatine bone. Those are the so-called pterygoid plates of the sphenoid bone. The sphenoid bone is a bone of the brain case region, but it really makes its way all around different portions of the skull. Let's take a look at the TMJ, the temporomandibular joint, which, if you recall, is the only movable joint in the skull. None of the sutures have any independent movement. So here's the temporomandibular joint, where the head or condyle of the mandible sits into the temporal fossa on the temporal bone. The anterior portion is called the coronoid portion of the mandible. And this is the area of movement. There's an articular disc there that allows for that movement. Anterior to the TMJ is the zygomatic arch, which is made partly by the temporal bone and partly by the zygomatic bone. And that TMJ area is problematic for many people, as we've discussed. So the zygomatic arch can be easily palpated on yourself. And if we want to look at some other bony landmarks, we can see the supraorbital foramen in the frontal bone, we see the infraorbital foramen in the maxillary bone, and we see the mental foramina on either side of the mandible. These are for sensory nerves that supply the face. In the posterior orbit, we can see how the sphenoid bone contributes to much of the anatomy of the posterior aspects of the eye sockets, as well as those pterygoid plates that I mentioned earlier. Another bone that is important for its muscle attachment sites is the hyoid bone that we see here. Remember, that's an unusual bone because it's the only bone in the body that doesn't directly articulate with any other bone, as you can see here. The hyoid bone is a small and delicate bone, but has many attachment sites, including to both the mastoid and styloid processes of the skull. It's also connected down by muscles to the sternum. Beyond the skull and the hyoid bone, we need to address the vertebral column, the body's main axis of support. And here we can see an anterior view with the entire rib cage on. If we look at a side view, if we want to turn to the side, we can see how the stacking of 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, and the sacrum and coccyx all contribute to this axis of the body. So let's talk about the spine. If we address the spine, remember there are 7 cervical vertebrae of the neck region, 12 thoracic vertebrae that each have a rib attachment, 5 lumbar vertebrae in the low spine, and then the sacrum and coccyx, which form the tail end, pardon the pun, of the vertebral column. If we want to see how the vertebrae stack, we could take a side view and notice the curvatures, that cervical curvature, which is a secondary curvature gained when a baby begins to hold their head up. A thoracic curvature, which reminds us of that primary curvature of the fetal position. The lumbar curvature in the low back and the sacral curvature. It's the stacking of the vertebral column that really gives us our flexibility in terms of twisting motions of the body. If we want to take a look at an individual vertebra, we can highlight it. And here's our 3rd lumbar vertebra with its main bony features. You see the body of the vertebra, you see the pedicle, the transverse processes that stick out to either side, and the inferior and superior articular surfaces that are going to link the vertebrae together. Posteriorly, we see the spinous process. And if we bring the spine back, we can see how the stacking of all of the vertebrae contributes to the great degree of flexibility that we have in the spine, and how one vertebra's inferior articular facets overlaps with the superior articular facets of another. On the side, we get the sense of how small openings are left between adjacent vertebrae for the spinal nerves to come out. We can see the spinous processes. You can feel those in some areas of the spine and not in others because of the presence of ligaments. So let's take a look at the first couple of cervical vertebrae by taking away the skull. Now we can see C1 called the atlas because Atlas held up the world like Atlas holds up our head. And then we see it followed by C2, which is known as the axis. We can see that C1 has a ring-like structure. It lacks the typical anatomy of a standard vertebra. And if we remove it, we can see the dens or odontoid process of C2 that allows for the great deal of rotation we see between the skull and C1 sitting on top of C2. So now let's address the 24 ribs. Remember, there are 12 pair of ribs, and we designate them as true ribs if they have their own individual attachment to the sternum, and then false ribs if they either don't connect to the sternum at all or borrow the cartilaginous attachment of rib 7. Let's take a look at rib 1, rib 2, rib 3, rib 4, rib 5, rib 6, and rib 7. Notice they all have their own cartilaginous attachment to the sternum, which makes them true ribs. Ribs 8, 9, and 10 borrow the attachment of rib 7, so they are a type of false rib, and ribs 11 and 12 are the floating ribs that have no attachment to the sternum at all. The sternum itself is composed out of the manubrium, the body, and the xiphoid process. And remember, this manubrium meets the body at a ridge called the sternal angle, which is an important anatomical landmark. Each rib articulates with 2 points on a vertebra. The rib tubercle attaches to the transverse process, while the rib head attaches to the body of a vertebra. So that's how the ribs articulate with the spinal column itself. But what about the ligaments of the spinal column? Remember that we have to keep this spine as intact as possible without any shifting because the spinal cord itself is inside the vertebral foramina. So let's take a look at those ligaments, but first let me take off the rib cage, take off the upper limb bones so we can really focus on this spine. Right, so there is a supraspinous ligament that runs down the length of the spinous processes, and it's enlarged up near the neck as the nuchal ligament. That's why we can't feel the spinous processes on cervical vertebrae very well. And then if we tilt just a bit, we can see the interspinous ligaments. Each one is its own entity. And we can see ligamentum flavum. Again, each one is its own individual ligament. Now, ligamentum flavum is on the inside of the vertebral canal, whereas other ligaments are on the surface. For example, we can see from the front here, the anterior longitudinal ligament that runs down the length of the vertebrae. And if we section the vertebral column in half, we can get the sense of how the intervertebral foramina allow the nerves to exit, and anterior to them is the posterior longitudinal ligament that is the counterpart of the anterior longitudinal ligament that runs down the anterior surface of the bodies of the vertebrae. Now, since the bones are the framework of the body, let's now use that framework and add the muscles to complete our study of musculoskeletal anatomy of the head and trunk. And we'll start with the facial muscles. As you can see, I've brought up a different cadaver this time, and this female has good muscles of facial expression. So let's take off the skin and have a look. So we can start with the forehead and see this frontalis portion of the occipitofrontalis muscle. That's the muscle that wrinkles the forehead. And we can see around her eyes the orbicularis oculi muscle. That lets us close our eye. The outer circular portion causes us to squint, and the portion on the eyelid is the one that we use to blink. We can see her corrugator supercilii muscles, and those help wrinkle the brow. We can see zygomaticus major, and that's our smiling muscle. This person has a zygomaticus minor muscle right next to it. And In this case along the nose, for levator labii superioris, they gave two different distinctions, this aliquot nasi portion along the nose, as well as the larger levator labii superioris that helps us raise the corner or one of the upper lip sides of the mouth. Here's orbicularis oris, an orb-shaped muscle that runs around the lips for puckering up. We can see over here the depressor anguli oris, a frowning muscle, as well as platysma, sometimes called the shaving muscle. It's within the skin of the neck. And if you remember, these muscles largely insert on skin, so they're very different from other skeletal muscles. In the cheek wall, we have the buccinator muscle. That's what allows us to suck through a straw or to blow a trumpet. And those are some of our major muscles of facial expression. Keep in mind that all of them are governed by the facial nerve, which is cranial nerve 7. Now, if we want to go around to the side, we can take a look at some muscles of chewing. The temporalis muscle originates off of the temporal lines of the skull, and it inserts down on the coronoid process of the mandible. It helps us to close the jaw. And a big, powerful muscle, the masseter, is on the mandible itself and inserts on the zygomatic arch, right? Both of those are involved in closing the jaw and clenching the teeth. The pterygoid muscles are deeper, and we'd have to take off portions of the jaw to show those. So now let's take a look at some muscles within the neck itself. And we'll start by taking off platysma so we can see some of these deeper muscles. You can see sternocleidomastoid. As its name implies, it runs from the sternum and clavicle up to the mastoid process. As we can see here, when both of those muscles are used, we flex the neck. But when one is used, we get that contralateral action of pointing the face toward the opposite side. Now let me turn a little more to the side, and we can see trapezius posteriorly. We'll cover it more with the back of the neck, but these two muscles, trapezius and sternocleidomastoid, are both supplied by cranial nerve 11, the spinal accessory nerve. Now let's take off sternocleidomastoid. And we can see the scalene muscles in this area. The scalene muscles, when used on one side, will tilt the head laterally, but when both are used, can help flex the neck. There's an anterior scalene, a middle scalene, and a posterior scalene muscle. The infrahyoid muscles go largely between the sternum and the hyoid bone, and they help to press the hyoid bone. Tucked underneath the chin, we could see the suprahyoid muscles, and those are muscles, small muscles of the neck that really are more concerned with movements of the hyoid bone and the larynx, such as in swallowing. So now let's take a look at the muscles of the trunk, both anterior and posterior muscles. And to do that, I've taken off the limbs so that we can enlarge and focus in on muscles of the chest, muscles of the abdomen, and muscles of the back. And I'm going to use the remove tool because we're going to start looking at these in layers. Here's pectoralis major, a dominant muscle in the chest with both a sternal and clavicular head. And if we remove that, we can now see pectoralis minor. The pectoralis minor muscle covers over the rib cage, and if we tilt to the side, we can see serratus anterior with those serrated edges. That attaches to the scapula. If we remove that, then we can see the intercostal muscles. Another muscle of the chest, tiny as it is the small subclavius muscle. And all of those are supplied by nerves of the brachial plexus, since those are muscles that, even though they live on the chest, they are upper limb muscles. The intercostal muscles are muscles of the thoracic wall itself, and they run between adjacent ribs, external, internal, and innermost intercostals. So let's remove those. Now we can get a look at the contrast of the two sides of the body with chest wall muscles in place and with them removed. With regard to the anterolateral abdominal wall, the external oblique passes with fibers down and in like hands and pockets. If we remove that, we see the internal oblique muscle. The internal oblique has fibers at right angles to that. If we take this off, it removes a portion of the rectus sheath, and we can see the rectus abdominis muscle. Rectus abdominis is a straight muscle of the abdomen that has these tendinous intersections that give some people that six-pack look. If we look out here, we see transversus abdominis with fibers that go around us like a belt. If I take that off and take rectus abdominis off, now we can see the respiratory diaphragm with its dome shape and its central tendon that appears lighter in color. There are several openings within the respiratory diaphragm, a hiatus for the inferior vena cava, a hiatus for the esophagus, and a hiatus for the aorta that all need to pass through the respiratory diaphragm. Another diaphragm of the body is the pelvic diaphragm. It's the floor of the pelvis that helps support our internal organs. We can see it composed here of a funnel-like muscle that includes the coccygeus, it includes the levator ani, and it includes the external anal sphincter, which allows us to control our bowel functions. At a more inferior level in the body is the urogenital diaphragm, and that has as one of its muscles the external urethral sphincter, which allows us to hold our bladder functions. Do you remember the complexity of the back muscles? We have a group of appendicular muscles that move the upper limb, starting here with trapezius. Let's remove that on one side. Then we can see latissimus dorsi taking origin off this broad thoracolumbar fascia and attaching to the humerus. Now we can see the rhomboid major muscle. Now let's take off rhomboid minor. And we can see levator scapulae here that elevates the scapula. And those are the 5 muscles of the superficial appendicular group. The next group are the intermediate respiratory muscles. We see serratus posterior superior and serratus posterior inferior. Those two are respiratory muscles. And now we can see all along this side the true back muscles or axial back muscles that are the ones that actually activate and move the spine. So all of these, with few exceptions, are supplied by dorsal rami. The true back muscles are an extremely complicated group. We have a superficial layer called the splenius complex, composed of splenius capitis and splenius cervicis. Then we get to our intermediate layer, which are the erector spinae. And if you remember the mnemonic I-like standing, iliocostalis more lateral, longissimus intermediate, and spinalis closer to the spine. And if you remember, those have regional distinctions. So here's iliocostalis lumborum, iliocostalis thoracis, and iliocostalis cervicis. Next, we get to the longissimus complex, longissimus thoracis, longissimus cervicis, and there's even a longissimus capitis. When we get to the spinalis muscles closest to the spine, we see the spinalis thoracis. The transversospinalis group are in the trough between transverse processes and spinous processes. And if you recall, we layer those from superficial to deep as semispinalis, which spans 5 or more segments, semispinalis capitis, and semispinalis cervicis, followed by semispinalis thoracis. all spanning 5 or more vertebral segments. Then we reach the next deepest level, which are the multifidus. We can see those come off in a row. Now we reach the rotatores, which are long and short rotators spanning 1 to 2 vertebral segments. What's left here are the last group of true back muscles called the segmentals. There are intertransversarii that pass between transverse processes and interspinalis that pass between on either side of the spinous processes of vertebrae. The last 4 muscles I'd like to cover in this lesson are the suboccipital muscles. They form a triangle at the base of the neck, and they govern the movements of the skull on C1 and C1 on C2. And we see here the rectus capitis posterior major muscle, rectus capitis posterior minor muscle, as well as the inferior oblique capitis and the superior oblique capitis. And all those are foundational to our understanding of the movements of the head, neck, and trunk. So now we've covered some key visuals related to the anatomy of the head, neck, and trunk of the body. I hope this intriguing anatomage technology has given you a more in-depth experience and added to your appreciation and understanding of musculoskeletal anatomy.